Hello, I'm Andrew Susskind, and I'm a psychotherapist and author based on the west side of Los Angeles since 1992, specializing in trauma and addictive compulsive behaviors. Welcome to my podcast, named after my recent book and workbook, It's Not About the Sex. Here we have direct and honest conversations related to compulsive sexual behavior and trauma, all from a sexual health perspective. Our intention is to offer fresh viewpoints and practical strategies toward establishing greater intimacy and a more deeply connected life. Let's begin. Dr. Tom Murray, a distinguished figure in intimate relationships, has been featured in numerous venues, including Washington Post, Huffington Post, and the Daily Mail. As a dynamic presenter at national conferences and esteemed institutions, he seamlessly blends contemplative psychology and Stoic philosophy with conventional methods in his clinical practice. His award-winning book, Making Nice with Naughty, explores the intricate dynamics of self-control and its impact on sexual and intimate relationships. We have Dr. Tom Murray with us, and Tom is going to be discussing something I've never talked about, and I don't know how many therapists or our listeners have heard of this before, but we're going to be talking about the over-controlled temperament. To begin with, Tom, what is the OC? Or down here it's Orange County, but anyway, what does the over-controlled temperament really mean?
Yeah, so well, first of all, thank you for having me on your show, Andrew. I'm so delighted to be here and to provide this content to your listeners. The over-controlled temperament is essentially when people have too much self-control. The opposite of the over-controlled temperament is the under-controlled temperament, right? And under-controlled people tend to be more impulsive, carefree, have their feelings on their sleeve, where over-controlled people tend to be much more planful, diligent. They tend to prefer routines. They prefer order. They're afraid of uncertainty. And of course, many of those features can be quite an asset, but in the extreme, they become maladaptive, where they interfere with people's lives. And that's the approach that I took in my book of looking at how that temperament impacts sex and intimate relationships.
So I'm wondering if you can elaborate a little bit on how it interferes with people's lives.
Part of our ability to have a positive mental health framework, right, is that we as David Lynch, the developer of radically open dialectical behavior therapy, says, is that mental health is really about cultivating a life worth sharing. So how
Mm,
are we in relationship to others?
mm,
Are we psychologically flexible, or are we so rigid that we aren't willing to express vulnerability, for example? And how vulnerability is so closely tied to developing intimacy with others, and so those who are afraid of the uncertainty that comes with vulnerability may pull back to avoid that negative feeling, and thus be not developing those important relationships.
I was caught with the expression a life worth sharing, right?
Yes.
I've heard so many times a life worth living, but a life worth sharing is the relational piece of that, which of course we know is part of what's not only necessary, but how we're biologically wired. So
Mhm.
say more about that. A life worth sharing. I think that's so vital.
Yeah, as you kind of mentioned, our ability to navigate important relationships certainly lends to a lot of positive health effects, right? If I can frame it maybe this way, in the extreme of the OC,
Hmm.
so these are well, first of all, these are temperaments, and temperaments, as many of the listeners may know, are neither good nor bad. And two of the
Right.
most famous temperaments are introversion, extroversion,
Hmm.
right? So it's neither good nor bad, but it's really talking about maladaptability. And so at the far end of the OC temperament, we have diagnoses like anorexia.
Hmm.
We have obsessive compulsive personality disorder, not to be confused with OCD. We would have schizoid personality disorder. Sometimes very chronic depression and anxiety is a function of the OC temperament. And so, what a lot of those core features have in common are these four deficits
Hmm.
that Thomas Lynch's research found. And one of those is that very low openness and receptivity to novel experiences, to the unexpected, right?
Hmm.
And you can imagine, particularly as it relates to sex and intimacy, if I am unwilling or unopen to novel and unexpected experiences, then relationships can become quite stale pretty quick,
Sure.
right? Or if I feel like sex has to be at 2 o'clock on Saturday
Hmm.
every week,
Hmm.
right? Or, that I don't want it to be spontaneous. I need to know exactly when it's going to happen, where it's going to happen, how it's going to happen. Those kinds of features, you could see how that would negatively impact relationships. Kind of the example too, another one is low flexible control, so that need to have structure and order. And the
Hmm.
example I give in the book is those people who go behind their partners to rearrange the dishwasher because it wasn't done right.
Right.
Or they don't want anybody to fold their laundry because they have a very specific way. Well, when OC people do those, and I'm an OC person,
Mm.
and a disproportionate number of therapists tend to lean OC,
Hmm.
right? Then the general we're overly represented.
Interesting.
If I show up in those rigid kinds of ways, then that's communicating to my partner something,
Hmm.
right? Which it tends to be is not positive, right? That somehow I'm communicating to them that they are not doing it right.
Hmm.
Well, that has an impact on a relationship. Versus if I'm accepting of how they do things and the unique ways that they do things, now we're
Hmm.
cultivating a life worth sharing.
That's beautiful. First of all, I appreciate you mentioning your OC tendencies. I can also fall into that category for sure.
Yeah.
Um, I was thinking about how the healing trajectory partially has to do with flexibility, has to do with actually playfulness and
Hmm.
fun, has to do with improvisation. And all of these qualities are part of sex and intimacy, right? So
You
I, I,
bet.
I really hear how vital this is for those of us who carry these survival strategies from a young age, but it outlasts its purpose.
That's right. That's right. I often say that a personality is the sum of all of your best attempts to survive childhood.
Mm.
And in many ways, the OC temperament can really be a powerful tool to survive childhood, especially a childhood that is surrounded by chaos, right?
Mhm.
And the
Mhm.
mind says, okay, if I can just be good enough, if I can be perfect enough, bad things won't happen to me. And so as a
Mhm.
consequence, uh, uh, we develop these kinds of skills that help us to navigate life. For example, one of the third core deficit
Mhm.
is inhibited emotional expression. So if an OC person, if they're anxious or depressed on the inside, the world out there would never notice. In fact, if you
Mm.
ask an OC person who's anxious or depressed on the inside, how are they doing? Their favorite F word is fine, right? How are you doing? Ah, fine, fine, right?
Yeah.
If they are angry and upset, maybe agitated, they may use their other favorite F word,
Mhm.
frustrated.
Mm.
I'm frustrated. This is frustrating. And so you'll
Mhm.
hear that kind of a very contained way of expressing emotions. In fact, if you can, we listeners won't see this, but my hands are really centered into my body, and that when OCs communicate, you'll notice that their hands very rarely extend beyond the perimeter of their sides.
Mm.
Where you see people, their hands are all over the place,
Hmm.
right? Because there's this tendency towards a constrained emotional expression. I'll give you another
Mm.
example. When I was in graduate school, I had a professor review my tapes, and he says, "Tom, you have perfected the poker face." He said, "The problem with that, however,
Hmm.
is that when people are giving you information, they have no sense of what you're doing with it." Later, years later, I remember sitting with a patient,
Hmm.
and this was when I was a director of a university counseling center. And the patient said, Tom, I get this strange feeling that at any moment you're just going to pull a knife from behind your back and eviscerate me. Right?
Wow.
That was the projection, you
Hmm.
see.
Hmm.
Um, and I came back with a kind of psychodynamic response of, "So you're afraid I might make you spill your guts." But what he was really getting at was, when we have a blank face, when we have a neutral face,
Hmm.
the other experiences that as threatening, right? So go to your partner and ask your partner, "Just look at me with a neutral face."
Hmm.
You just experience what that looks like. By the way, what happens when we look at our iPhones? We have a
Mm.
neutral face.
Sure.
And if we have young children around and we're just on
Hmm.
our iPhones, what they see is a neutral face. And that is not cultivating a life worth sharing, which brings us to the fourth deficit,
Hmm.
right? Which is low social connectedness. Right? A
Mm.
lot of
Hmm.
a lot of OC people tend to be aloof, tend to have distant relationships. They're afraid of. There's the invisible audience that a lot of OCs have, which is, I'm afraid of what other people might be thinking, right? And so as a consequence, they tend to pull away socially, while at the same time they may have a lot of envy, a lot of bitterness. They may have reduced empathy because they see how other people are successful and wondering why they haven't been so successful. So again, uh, uh, that contributes to lives of isolation. In fact, one of the more common complaints that OCD people talk about is loneliness.
Mm. Sometimes profound
Yes.
loneliness.
Oh, you bet.
Yeah.
You
So
bet.
we're talking about folks who are having a lot of difficulty connecting, having a lot of difficulty even knowing what's going on. I was thinking about somatically what's really going on in their body. It sounds like it's really like being imprisoned in some ways for folks who
Mm.
have extreme OC. I was thinking about out of control sexual behavior. And what's interesting in my own story is that I definitely had this kind of contained, constricted way of being in the world to some extent, not too extreme. But I also was breaking a lot of rules and going out and acting out sexually and having all of that kind of extreme exploration, so to speak. And so in a way, I think when we're talking about therapeutic direction for folks like this, can you speak to that for a moment? Like how do people who have this or who identify this in themselves or in loved ones, how do they get better?
Yeah, yeah. So if I may, can I swing back to something you just mentioned
Of course.
before I answer that? A lot of OC people will still do behaviors that appear impulsive, such as out of control sexual behavior. And so it's important that when you're trying to figure out where someone falls on the UC-OC continuum, that you're not just paying attention to the behavior. So a good example of this are people who cut, right?
Hmm.
Those who cut or who self-injure,
Hmm.
one would naturally think, "Oh, that must be UC. That's a
Hmm.
UC behavior.
Hmm.
Otherwise, why would you do it, right?" But some of these people who cut, when you ask them to talk about what goes on with themselves prior to the cutting. They might say, "Oh, I think all day about cutting. I think about where I'm going to cut, how I'm going to cut, how deeply am I going to cut. I think about where to put it on my body so that nobody notices. I think about
Mm,
the post-cut care. How am I going to take care of myself?" Well, all of that planning is an example of OC. That is a
sure.
clear indication that that is not impulsive,
Hmm.
but quite planned,
Hmm.
right? Um, in a similar vein, people may engage in out of control sexual behavior, but they have already constructed their own set of rules. I will only do it here during
Mm,
this time under these certain circumstances. I'll only go to the other person's house. I will not let anybody at my house, or vice versa. I will only do it at my house so that I
hmm.
have a firm sense of where everything is. So
Hmm.
on one hand, you can think, well, if you're gonna have indiscriminate sex with people, that seems very UC,
Mm,
but it's very much an indication of an OC style, right? And historically, dialectical behavior therapy,
hmm.
DBT, was designed for UC folks. So the
Mm,
borderline personality disorder, for
hmm.
example,
Hmm.
narcissistic personality. And what Thomas Lynch found is that when he looked at that UC-OC component, he found that those who are already OC became more OC in the DBT group,
Hmm.
because the DBT group is all about emotional self-regulation.
Mm.
Well, OC people are experts at emotional self-regulation, right? They are able to delay gratification like nobody else,
Mm,
right? So he developed radically open dialectical behavior therapy for that OC style, which is, as you talked about earlier, is a style to help them relax their grip around rules, to relax their need for predictability, conformity, to allow for greater spontaneity and fun in their lives. So, in essence, to learn how to turn down that volume on their OC temperament without an expectation that they'll ever become UC.
mm. Sure. Thank you for sharing those details. That not only makes a lot of sense, but it also points out how important it is to know this both as clinicians and for our listeners to get a sense of how that can look one way, but is actually the other.
That's right. And to the a piece is to use a strategy that
Hmm.
best fits with that particular client's psychology. To give you an example,
Hmm.
I'm drawing a blank on the study, the name of the study, but there was a study that looked at the explanatory style of those who had problematic drinking, right? And what they found is that if someone explanatory style for their alcohol use was that it was a disease, they did much better in a 12-step style program.
Mm.
But the people who thought of their problematic drinking as more of a bad habit
Hmm.
did worse in AA,
Hmm.
did better in more of the alternative non-AA approaches,
Hmm.
right? More of the maybe the moderation management approaches.
Hmm.
So, that concept of how do we listen to the client's theory of change and then route them into treatment models that reflect their theory of change, rather than forcing everybody into the approach that we're offering at this particular clinic at this particular time.
Right. So we can't put a square peg in a round hole.
Right,
For
right.
sure. Okay.
Yeah.
So why don't we shift gears a little bit, and I want to talk about how this applies to sex and intimacy. So,
Mm.
so Tom, can you explain how desire diminishes in monogamous relationships? How does that work?
Yeah, yeah. There's a finding, that in monogamy comes with its own occupational hazards. And one is that for every year that a couple's together, their liking each other declines 4%, and their lusting declines 8%. So why might that be the case? Well, I often use the metaphor of the beach. A lot of people go to the beach. They decide, you know what, I love the beach so much. I'm going to buy a house at the beach, right? And I'm going to be at the beach every day.
Mhm.
And when they move to the beach, what happens? They're at the beach every day. And then there comes a moment when life happens and they're like, oh, I'm going to take care of this thing because I know the beach is already going to be here. So I'll
Mhm.
take care of this thing and then go to the beach tomorrow. Well, what happens tomorrow? Life. And they don't go to the beach the next day. And
Mhm.
so, in a similar vein, what happens in marriage is that our partner no longer becomes exciting to us. They just become another artifact in our life. But there's this thought that they're always going to be here tomorrow. So I don't have to
Mm.
invest in the relationship today. I
Mhm.
can put off and wait until tomorrow. But what happens? Tomorrow never comes. And so you see this decline in desire. The other piece is that we desire things more when we feel a sense of competition around it.
Mm.
So I don't know if you've ever bid on anything on eBay, but when you know that someone else is bidding on it,
Mhm.
you're inclined to want it more. Or there have been studies that show that if you're waiting for a parking spot, waiting for someone to get out of the parking spot, the
Mhm.
person in the parking spot spends more time in the spot when someone's waiting for it than if no one is waiting for it.
Interesting.
Yeah. So that
Hmm.
impacts desire. The other thing is that I distinguish the difference between closeness and intimacy.
Hmm.
Most of my couples, and I'm primarily a couples and sex therapist,
Mhm.
most of my couples, when they come in, they often will say, we're not close enough. And I can spend a few, 10, 20, 30 minutes with them, and I realize, ooh, they're too close. They're too close because they have a focus on low risk, low anxiety, high predictability, comfort, familiarity.
Hmm.
Intimacy, on the other hand, is high risk, high anxiety, low predictability, newness, novelty. So think of the first dates with someone or
Mhm.
affairs for that matter. What are affairs? High risk, high anxiety, low predictability, newness, novelty. So you can have a lot of desire there. Unfortunately, that burns hot and it's unsustainable.
Hmm.
And so closeness comes in as it needs to in order to know who's going to pay this bill, who's going to pick up the kids, who's going to do that and the other thing. But at its extreme, closeness will push out intimacy and drive down desire.
That's really, really important for us to dive into further. We don't have the kind of time to do that, but I'm just very struck with how there's a myth, oftentimes about what closeness really is. And what I hear you saying is that to keep the aliveness in the relationship, to keep that fire going, the heat, requires all of those elements, and yet there's almost I don't know. It just sounds like there's this idea that some of us will create, that doesn't really match with what's vital for the
Yes.
relationship to grow.
Yes, yes. I might get into trouble when I say this. Uh
Go for it.
but I'm a firm believer that the Hallmark Channel has done more damage to our appreciation of relationships than porn. And I use Hallmark Channel as a metaphor, but this
Yeah,
Hollywood notion of relationships,
yeah, yeah.
right, is much more damaging than pornography has been to relationships. I mean, I've even had people in my office say that they just want a Hallmark marriage, as if that's actually attainable, right? But it's not. Life is way more complicated,
Hmm.
right? And
Hmm.
there's a lot of work that's necessary. In fact, people are so allergic to having conflict in their marriage that they think any conflict is evidence of something bad, when conflict is the only place, the only space where the evolution of a relationship can take place. If a single-celled organism in that protozoic soup at the beginning of time was completely comfortable,
Hmm.
evolution would have never happened.
Yeah. I always say that conflict is an opportunity for deeper contact.
Yeah,
Yeah,
yeah.
that's great, Tom. So you were sharing with me this idea of the wanting versus willing dynamic. So can you describe the wanting versus willing dynamic, and why willingness to have sex is so important?
Yeah. One of the myths that is perpetuated is that everyone should want or desire, have a sense of desire around sex, that has to come first. I desire to have sex. And what that's built out of is what Emily Nagoski calls the spontaneous desire model,
Mm.
that I should just spontaneously think about sex and want to have it, right? And that is typical of male desire, if you will, right? And it's often what's shown in pornography, this kind of spontaneous, the plumber comes to the house and bam, I'm just ready to go. That message has really hurt people's understanding of sex and sexuality.
Hmm.
There are two other types of desire. There's responsive desire, and then there's contextual desire. Responsive desire is that you just need a little bit of a clue that your partner's interested, and you're like, oh, I know what we're doing here. So if my partner rubs my leg, oh, I know what we're doing here. And then there's contextual desire, which is more of this dance between these accelerators and inhibitors as it comes to sex. So an accelerator may be um, my partner is washing the dishes. I find that very attractive. Or my partner is, just came home from the gym and they look all sweaty. That's really attractive. Whereas
Hmm.
others, that may make them unattractive, right?
Hmm. Sure.
So with contextual desire, they don't have spontaneous desire. They may not have a want, a register a want, but they may have a willing. So for a lot of people, particularly women, they will have a want once they get started. So it doesn't initially register as a want, but they
Mm-hmm.
will get started, and then now they're in it, and now they're going along, and now they're ready, you see. But if they bought the myth that they have to feel the want first,
Mm.
they may go inside. Do I want it? Nope. Do I want it? Nope. But willingness, particularly in the context of a monogamous relationship,
Hmm.
to underscore that,
Yeah.
is a much better question. Am I willing to be turned on than versus am I already turned on?
Hmm. It's a question, Tom. If someone is able to be open-hearted to the willingness that you're describing, they still have the option to say yes, no, or maybe. Is that correct?
They absolutely do. In fact, it's important that no always be an option, because it is the ability to give a no that gives the yes its meaning. If you could only say yes, then the yes wouldn't have any meaning.
Hmm.
That being said, when it comes to monogamy, I'm afraid that I'm going to sound like I'm anti-monogamous, which I am by far not anti-monogamous, but
Hmm.
it does come with its own set of occupational hazards that I don't think people really talk about. And
Hmm.
one of those is the rights and responsibilities to sex,
Hmm.
within a monogamous relationship. So within monogamy, the right is that each partner gets to enjoy the other's bodies in ways that other people don't have access to,
Hmm.
right? That's the right. You get to enjoy my body, I get to enjoy your body in ways that other people don't get to.
Mhm.
The responsibility, and this is the piece that gets mistaken here or
Mhm.
forgotten, the responsibility is that in this monogamous relationship, I am responsible to be interested in the sexual needs of the other.
Mhm.
I'm responsible for checking in with my partner. Are your sexual needs satisfied? Are we on the same page around that?
Mhm.
And all too often, what happens is someone just stops being interested, and then they get angry that their partner is interested.
Mhm.
When in fact, what has happened is the non-interested partner has now forced the other into celibacy. And
Mhm.
we don't acknowledge that enough. It is totally appropriate, totally acceptable for someone not to be interested in sex anymore. But it's not acceptable to expect that the other will also not be interested.
Sure. Right. Wow. So that particular issue around monogamy and the occupational hazards, as you call it, is fraught with issues and tentacles that go in all kinds of directions. I'm very stimulated as you're talking to consider another episode just on that alone, because I think the idea of the occupational hazards of monogamy is not talked about enough.
That's
And,
right.
and yet it's so essential to actually find ways to be fully yourself and to have those honest conversations.
So important, so important, especially with couples when they come in. Low sexual desire is one of the most common complaints that a sex therapist is going to encounter.
Hmm.
And I will ask a couple, are you monogamous? And they'll often look strangely at each other, and yeah, 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 yeah. They haven't had sex in many months, maybe years. And then I ask them, well, what is the definition of monogamy? And they will eventually come to, well, sex with one person. And I'm like, yes, that's exactly right. Monogamy is sex with one person. So if you're not having sex and monogamy is sex with one person, then you're not monogamous. You're
Wow.
something else. I don't know what that something else is, but let's not be confused. Right?
Hmm.
Now, I, of course, don't define for the couple what sex means.
Right.
It's not exclusively penetration. But
Hmm.
if they themselves agree that what they are doing is not sex,
Hmm.
right? And
Sure.
so highlighting the importance of that
Hmm.
is vital and moving the pendulum in a different direction so that they
Hmm.
are reframing that, oh, we do have a responsibility to each other to be interested in the sexual needs of the other.
Mm, very well said. We're almost out of time, but I wanted to ask one last question, which I often ask at the end of our episodes. If there was one or two takeaways that you would like our listeners to be sure to hold on to from this conversation, what would they be?
Making Nice with Naughty is the book that I wrote is really an invitation to be rebellious. Many people who are over controlled learn to live within this really strict set of rules and expectations of themselves and others. They may have been told, don't be naughty, that's bad, or if you just live by the rules, if you do what you're told, you'll live a happy and successful life. But that can make living life less have less vitality, as you kind of mentioned earlier.
Sure.
And so I'm inviting folks who read my book, I'm inviting them to be rebellious. I'm not talking about doing things that they find particularly dangerous, but being rebellious in the sense that they are able to pursue sex for the pleasure of it
Mhm.
rather than with this a goal orientation that so many people, particularly OCs, tend to lead with. Is my partner being satisfied? And is my partner getting what they want? But in an almost neurotic, anxious fashion.
Mhm.
And they give not enough attention to the question of, am I satisfied? Is this pleasurable for me? What do I need to do differently to have a good time in this sexual experience with my partner, to really reclaim their own sexual identity so that they're led by pleasure and less by performance.
Mm,
And lastly, I would say, particularly for my OC readers, many of them are highly allergic to feeling awkward. And yet, what is awkward? High risk, high anxiety, low predictability, newness, novelty. Awkward is an indication that you're moving in a direction that it will allow you to discover something new about yourself. And see that as a form of an aphrodisiac, right? That is something to move toward
mhm.
rather than to step away from.
That's great. I think that's an awesome place for us to wind down today. I really, really appreciate you coming on the podcast, Tom. It's been a pleasure meeting you. It's been a pleasure speaking with you today. I feel like we just brushed the surface of a lot of really, really important issues that I'm so glad you're out there spreading the word, because there's a lot of folks that don't understand these issues. And there's also a lot of healing that can continue to happen. So it's wonderful having you. And I certainly am pleased that we could spend the time together.
Thank you, Andrew. You've been a delight.
Thank you, Tom. Thanks for listening today. It was so great sharing the time with my colleague, Dr. Tom Murray, and discussing this really significant topic. He can be reached through his website at makingnicewithnaughty.com. If you're so inclined, please give us a 5-star rating and be sure to subscribe and share my podcast with those who may benefit. I look forward to you joining us the next time, and don't forget to stay connected.